First of all, thank you very much for joining us. Our first question would be, so the WHO is urging countries to test. So is North Macedonia doing enough testing? And do we have to enlarge the number of people being tested since there is now a local transmission of the virus?
Thank you very much for inquiring about the COVID situation. WHO has very clear instructions, or let us say recommendations to the countries to increase the testing process in order to isolate those people who may not have the symptoms of the disease but may carry the virus, and also isolate the persons who are having more likely transmission because they started to have symptoms, but they are mild. They do not necessitate hospitalization. And these are the ones who really should be tested. So anyone who has some mild symptoms of like upper respiratory tract infection symptoms would be advised to call the number that is put by the Ministry of Health, and also to seek testing.
So does that mean that North Macedonia has to now enlarge the number of tests?
I think that anyone who has symptoms will help a lot by coming forward voluntarily and being tested, because they will interrupt the possibility of transmission from one person to the other. And if you look at the situation of Macedonia, you have two areas in Macedonia that already have a community transmission, and it's very important that there be also a community response to help interrupt the transmission of the virus.
We had a couple of situations where the tests on some patients were negative twice and then turned out positive, or vice versa. So how is this possible, and are the tests 100% accurate, and why does this happen?
You know, in science, there is nothing 100%, but I can say that all the tests that have been provided by WHO and that are used by the National Virology Laboratory, that is doing most of the testing, are quality assured. So what is important is to import or to get tests that are quality assured, but this is not enough. There is always a human factor in how we take the samples, you know, the swabs, and how we transport them. Everything should be done by the book and by the specifications. So it's a chain of events, and if those chain of events are not respected well in terms of technical know-how, I think there will be a breach in the result, yes.
According to the latest statistics, we have over 7,000 of coronavirus cases and over 30,000 people dead. But in some countries, the death rate is low and in some is high. Why are the death rates different in different countries?
Different countries differ in many ways. And the virus by itself will cause disease in anybody who is exposed. But it will cause severe disease, and this is what we are seeing. So the numbers that you have are only, let us say, maybe less than 20% of all the possible disease that we can see. And the 80% of people who are affected, we don't count them. So we will look at this as the tip of the iceberg. So first, how the virus is transmitted also in the community. So if you have communities who do not have severe cases, like because of the age composition of the community, because of the also respect of the instructions of physical distancing that the countries, all the governments are telling their people to do, and because they also take precautions of cough and also take precautions and go testing, in those places where there is no, where everybody will follow the instructions, you will have less deaths. But in addition, it's about how many younger people and how many older, maybe mainly aging people you have in a country, and also how fast the health system would respond.
Mm-hmm. Many people are wondering what happened in Italy and why are there so many corona victims over there. Where did Italy went wrong? Why do you think the death rates are so extremely high in this country?
I wouldn't say there is something wrong. I would say that this is learning by doing. It is not easy. Italy has been the hub during the past few months when this all started in China. Italy was receiving a lot of people from around the world because it's a touristic country. And this concentration of people and mass gathering is one of the situation, is one of the factors that has increased the risk for Italy. I think the problem was that instead of an epidemic that is a bit slow over time, and this is what we are trying to do here, to slow the epidemic by these instructions of not mixing and physical distancing. So instead of Italy facing the epidemic slowly because of this mass gathering, I think they have shooted up with a lot of number of people who need respirators and who need assisted care at a time where none of the health system could really react at that time because everything was unknown, and it is learning by doing, and the great mass of people who are sick at the same time requiring all of them intensive care is not easy to handle.
And unlike many other countries, Sweden is not taking any drastic measures. So the restaurants there are still open, people go to work. Is this a good way to cope with such a situation? What do you think about the Swedish authorities and their way of coping with the pandemic?
Yes, I have seen that. And I think every country has to take the decision for its own population. In Sweden, it's true they're going out, but at the same time, they are also abiding by a lot of instructions from the government. Like also Sweden has declared that they have enough beds and enough respirators and enough preparedness of the health system to deal with any number of cases. So, however, I would say that at the same time, exposing the vulnerable people like the elderly will create more death, whatever is the situation. So we have to wait and see. We don't have enough time to see if this has been effective or not.
And we know that world experts are already working on finding out a vaccine against the virus. So when can we expect to have the vaccine?
That's a $1 million question, because I can tell you that immediately after the virus has been isolated and its genetic material has been identified, the vaccine trials have started, the vaccine manufacturing has started. WHO works very closely on this issue worldwide, and there are actually now 25 different vaccine trials to find the right vaccine. Usually any vaccine of any disease will require years to be set in place. So in this case, we really don't know. All what we know is that all the efforts have to go there for vaccine and also therapeutics, because we know now we don't have even a therapeutic agent. We don't have something that cures the patients. All we do is to support the patients during this crisis, health crisis. So vaccines are there. They are trying to push for finding the right one, but we are still to wait for the results.
And what are the expectations of WHO? So when will the pandemic be over? And how long do you think it'll take for life to return to normal?
Look, not to cause fear or disturbance, but this we have to see country by country, because all depends on the response. We have seen countries like China being able to control the situation with drastic measures that I don't think any other country in the world can have. And they controlled everything in 3.5 months, but still there are a lot of control measures in place. So this thing takes time. We have seen countries like Italy still struggle, and Spain and even France still struggling with how to contain the disease and how to interrupt the transmission of the virus. So we wouldn't generalize. It needs time. As long as there are very hot spots where you have increased transmission, like in US, like in Europe. Europe now is one of the epicenters of the epidemic. We will have to wait and see. But what's important is that every country takes whatever measures they can, and to use all measures that we know about can be effective, put them together and try to use them. And most important is the response of the population. I have seen that some people are still getting fines from the police because they are breaking the rules and going out when they are told to stay home. People in isolation, I really tell them that they are really gambling. Even if they don't have the disease themselves, or they will not be in a critical situation considering their age and state of health, but they are going not necessarily to hurt others and to transmit the virus. So really, we have really to go and abide. This is an extraordinary situation. This is not normal as usual, not business as usual. Everybody has to bear, to be patient, and to understand why these measures are being taken and recommended.
And finally, our last question, what would be your message to the public at this point?
Well, I tell the public that we are all in the same situation. We understand that things are not easy, and I understand also personally that things are more difficult for the elderly or those people who work day by day to earn their income, and it's very difficult. Mostly, I can say also to the healthcare workers. So the healthcare workers are putting themselves into danger. They are trying to give care as much as possible and be always present for us, not everywhere, not only in the COVID center, in the infectious disease center, treating the COVID severe cases. So these people are very precious, and having somebody to care for us is important. So we better follow the instructions. If you are told to stay home, please stay home. If you are told to take distance, take distance. Don't take risks. The risks is not only on one person, the risks are on the whole community. So this is all what I can say for now. And I wish everybody in North Macedonia to keep safe and continuing to do those multi-government efforts, multi-sectoral efforts to work together. And I think solidarity is very, very important. Every one of us should be humble, because we are not stronger than the virus. Anyone who is exposed will be infected and can infect others. So we really have to be humble for this one. It's much stronger than we are as persons.
Thank you very much for joining us in our program.
Thank you, anytime.